Welcome to the next episode of the Last Visit First podcast, live from Home Care 100. Again, Lincoln Group, thank you again for sponsoring us here and getting this conference together in Scottsdale, Arizona. We're at the Phoenician Hotel, having a blast. My next guest, Tarrah Lowry, Chief Operating Officer of Empath Health, based out of Florida, beautiful Florida. It's probably the only place in the United States that's as warm as it is here in Scottsdale right now, so we're very blessed to be here. Tarrah, welcome to the show.
Thanks for having me.
Good. Tell us about your company and who are you? What are you doing? Tell us about that.
So Empath Health is a hospice home health provider out of Florida. We're located in several of the counties in Florida. And we also do what we call full life care. So full life care means that we've gotten a little bit into managed care. We have PACE programs. We have a joint venture with an I-SNP company in Florida. We have physician practices. We are members of an ACO that we do with other hospice providers as well. So lots of extra things that we're learning about and growing.
That's cool. And size, give me approximate size patient-wise.
So patient census any day in hospice is going to be a census of around 5,500. And on the home health side, we have a census of about 1,200.
So for those of you who don't know, they have one of the most amazing inpatient facilities in the United States. And so if you ever need hospice, go to Florida. They have it's an amazing facility. I've been there multiple times. It's beautiful.
Yes,
It's
we
like
definitely
a
do.
giant hospital. There's one on the water. I mean, it's amazing. So these guys do inpatient care like nobody else. So you're at Home Care 100. What are you learning?
Well, this morning we were talking about payers and building those relationships with payers, and really learned a lot about the, we're 2% of what they're spending. So that's why they don't always return our phone calls. That's why we can't get the rates that we really would like to see. And it's also why they're not as invested in care in the home as we are, and we're passionate about it. I think, Tom, you've shared, we've lived it. We know the work and we know how important it is and how good the outcomes are. So I think growing that relationship is key to our future.
That's true. That's true. That's awesome. All right. So you were part of Trustbridge.
Yes.
You merged together with Empath. Two not-for-profits coming together. Might be one of the largest transactions in our space in that world ever.
Yeah.
What'd you learn from that?
Definitely. We're still learning.
Oh, good.
We're bringing together like cultures, but different cultures. We're also bringing together different service areas. So there's big differences in the clientele in the different service areas. And I think that everyone, when you come together, you feel a little lost when you have to change things that you believed were the right things, but it's a two-way street. So I think one of the things that we've been very intentional about is, instead of just saying, you're now a part of this is the way we do it, we've really looked at things and said, which is the best way to do this? So it's taken a little bit longer to get us on a one hospice model, but our goal is to be on a one hospice model. That means that we're using the same software. We are also doing the same things in the service areas. So our example we use is, if there was a hurricane in West Palm Beach and we didn't have people that were able to do intake, we would be able to have intake done on the other coast, because it's done in the same system and the same way.
It's awesome.
But we don't lose the individuality of our communities.
It's awesome.
Yeah.
That's really cool. Never even thought of that, but that's awesome. Yeah.
Yeah.
Most of the time a hurricane doesn't take out all of Florida. It takes out one coast or
Correct.
other. So you're both, yeah, that's good. And you guys do have a lot of hurricanes, unfortunately. Anything else that you're networking, all that kind of stuff? You met a lot of new friends here. What did you guys do last night?
Yeah, I think there's a lot of new people here this year. So I've met some people that I've never met before. There's some health systems that are here. There are a lot more private duty providers here. And so being able to learn about their businesses and the things that keep them up at night has been very rewarding.
That's cool.
And last night we went to dinner with Daniel from IntelliTriage, and he took us to the Element, and we had a chef's. We sat in this room that was like a chef's room, and it opens up to the kitchen.
Wow.
So we got to see him preparing our food. And
is that a local restaurant?
Yeah.
Hotel?
Yeah. It's not in the hotel.
Oh, that's awesome. I
It's
got to check
offsite.
it out.
You need to.
I'm
It
a
was
Scottsdale
fantastic.
guy, so we got to check it out.
Yeah.
All right. Tell us about, you're wearing a Whoop. How'd you sleep last night?
You do not want to know.
Me either. It was terrible.
Someone else just told me they took theirs off for the week.
I'm a big, no, we're not, this is not a shout out to Whoop, but we all wear Whoops now, and we check our sleep. And I actually downloaded the widget on the front of my phone. And so every morning I wake up and push it, and the first thing I see is the widget on my phone.
Right.
I slept terrible last night. Like, I drank too much, I guess, or something. I don't know. Your husband's here.
Yes.
He's one of my most favorite guys. Tell us about him. He's a Marine.
Yes, he is. He is.
Ex-Marine.
Yeah.
He's not ex-Marine. He's always a Marine. Once a Marine.
That's
He's not
right.
active anymore.
That's
He's a
right.
great guy. He comes to the conference every year. I love spending time with him. Everybody knows I was a Navy corpsman.
Yes.
What's he doing in the spouses program?
So today he's golfing. Him and Jeff Davis are on a golf cart together.
Oh, yeah.
And so he loves the spouse program. He wouldn't miss it. It's like his little mini vacation that he gets to come on every year when we do Home Care 100.
So jealous. Being him is amazing, I swear. I see all this stuff that Tarrah posts online. The spouse program is actually really good.
It really is.
Yeah. And then I know I've talked to Jeff too, and he's get to go play golf, get to hang out, go to big dinners.
Yeah.
And Home Care 100 and Lincoln do a really good job of including the spouses. And I think it entices more people to come to the show. So it gets more people to Scottsdale.
Yeah. And, the parties they have in the evenings or different get-togethers they have, being able to bring your spouse with you is definitely a plus.
Yeah, I agree with that too. So shout out to Jen Stewart and the rest of the team. That's a good thing. So
now, I was sitting at a table with spouses that are in like places like Nashville, and they're in the middle of this ice storm and no power, and they were not sending any pictures of warm Scottsdale home.
There's a mountain right outside the hotel here. A lot of people went and climbed that the other day, and they were like taking pictures and sitting at home. I'm like, no, you don't want to do that. Don't do that. Well, cool. Anything else you want to talk about?
Not that I can think of.
All right.
Yeah.
Thank you for being on the show.
Absolutely.
We just wanted to have a quick check in with everybody, and we thought we'd do some quick stuff here. And
yeah.
Appreciate you coming down.
That's awesome.